Welcome to Princeton Spine and Joint Center. We're glad you found us. My wife and I started this practice in 2008. We finished our training in New York and we moved back to our hometown with the sole purpose of starting a practice that we could focus on evidence-based medicine, delivered in a compassionate way, and just deliver exceptional care to one person at a time. We've been really grateful and humbled by the way that people have responded, and we're very grateful to our referring doctors and therapists for recommending us, and to our patients for recommending us to their family and friends. And it's allowed for some very quick growth that we hadn't really planned on or expected, but it's allowed us to do certain things that we're very excited about. So for example, one of the things we've done is we've brought in another couple of spine specialists. So we've been able to allow the spine specialists to really focus on spine and even parse out some of the more technical procedures so that we can allow our doctors to focus on very particular areas and really deliver the highest quality care possible. Meanwhile, we've brought in a few sports medicine doctors so that they can focus on the sports side and provide really excellent care when it comes to sports medicine. They're all fellowship trained, and it's really allows them to pursue their passion, which is taking care of athletes and people with sports-related injuries. My wife has been able to focus more and more on dance injuries, which as a dancer since she was walking is a real passion of hers. And we've also been able to open up a part of the practice that focuses exclusively on regenerative medicine. So there are some exciting, still experimental treatments that have come about, like PRP and different treatments where we do things like take blood and spin down platelets and inject them back in, and things that are really cutting edge. And in fact, three of us, myself included, and two of the directors of the regenerative medicine program are editing a book along with Joseph Herrera, who's the chair of rehab at Mount Sinai. We're editing a book on regenerative medicine for spine and joint pain. And it's allowed the individual physicians to pursue specific passions and be really the best at what they do in what they do, never losing focus. And this has been always never ever losing focus on making sure that the patient stays at the really center and the heart of what we do. Because at the end of the day, our model remains the same, which is that as long as we take care of one person at a time and get them better in a respectful way and a quick way, then everything else, has taken care of itself. And I think that it will continue to take care of itself as long as we don't lose focus on our core goals and core values.